Dr. Adam Davis here from South Georgia Spine and Joint Center. Today we want to talk about overall headaches. Okay, so, you know, everyone's had a headache before. You know, people who get them regularly. Some people get migraines. Some people get tension headaches. But what a lot of people don't understand, there's literally a ton of different types of headaches. And the key with treatments of headaches is really diving in and understanding what type of headache is it. All right, so there's ways to kind of pinpoint, you know, in a good assessment. One is just history overall. So just, you know, when does the headache occur? How often does it occur? Is it certain times of the month? Is it certain times of the day? You know, what type of pressure? Where is it located? There's a million questions to ask. And then there's a million things you can do in an assessment with ranges of motion and palpation and understanding which muscles are tense, which ones are not. You can talk about food and triggers and things like that, what they do for their occupation, look at their posture. There's a lot of things that contribute to headaches, all right? But when you're talking about like headaches in general, there's literally like 9 or 10 like specific ones that, you know, people talk about. And a lot of times some people don't know, you know, some of the other ones. So the one that most people talk about is a migraine headache. And that comes along with, you know, what they call auras a lot of times, not all the time, but, you know, where they feel it coming on, they get dizzy, what's called photophobia, like lights, things like that. It's kind of circles, little things that they see in the air, and then they sit down and have to be in, you know, inside their room where it's real dark with, you know, so there's a lot of reasons for migraines. A lot of the thing is hormonal. That's what some of the research says. That's why a lot of younger females seem to get, you know, migraines more. But, you know, hormones can do it, different triggers. Another classic one is a tension headache. People get that later in the day, and it kind of wraps around the head, you know. It takes a while to get to it. That's why it doesn't happen until usually in the afternoon after you've been tense all day working. You know, there's a cluster headache, which is one that's usually centered in one eye a lot of times. A lot of times it's seasonal with allergies and things like that. Obviously, you got post-traumatic, so you hit your head, you get in car accidents, concussions. Those are some classic headaches. TMJ-related headaches. So there's referral patterns to headaches when you have jaw issues. And there's a whole slew of things, you know, chiropractors and medical teams and physical therapy teams can do for that condition. Sinus headaches, that's a big one around here in South Georgia now. Everyone's got a sinus problem right now. You know, things are going around, you know, allergies, lots of sinus pressure, food sensitivities. That's another one. I know if I, you know, eat MSG at all, headache within 20 minutes, guaranteed. So that's just my trigger. So I stay away from MSG and as much processed foods as possible. But one of the most common headaches, all right, is what's called a cervicogenic headache. And we're gonna dive into what a cervicogenic headache is. But a lot of these headaches can be solved with good treatments. And it's not just chiropractic, it's an integration of medical, chiropractic, and physical therapy. So go ahead and sit back. Let's kind of dive into what some of these headaches are, really explain the mechanism possibly behind it and how we can treat this.
So as we said before, when you're looking at the history of headaches, you need to ask very intricate questions, you know, related to, you know, when is the onset? Is it in the morning, at night? The duration, you know, how long does this thing last, you know? Is it relieved by certain things, or does it spontaneously go away? All right, does it happen in short durations, or does it last a very long time? Location is a big one. That can kind of tell you referral patterns from different muscles and different nerves overall. You know, what is the quality? Is it throbbing, pounding, dull, nagging? These are all questions that you would need to know to kind of make a definitive diagnosis, all right? Is it aggravated with movements? That's a big one, because you can see if muscle is involved, all right? Visual prodromes, are there those things we were talking about, distortion of shape and size? Do you get nauseous, vomiting, diarrhea, photophobia, you know, visual disturbances, difficulty falling asleep, nasal discharge, tinnitus in the ears? You know, these are all things you would want to know, which would lead you to that definitive diagnosis once again. Another one that's overlooked is looking at medications and supplement use. You know, if people aren't following specific parameters of how to take their medicine, you know, their medications or their supplements, that can be a factor. Other factors are fever, fatigue, stress, you know, food additives, as I explained, that I have trouble with. Seasonal allergies, caffeine's a big one. Menstrual cycle, again, is one of the ones that, you know, overall we think is a possibility with young women, just due to the fact that there's hormonal changes at that time of the month, and that's a lot of reasons why, you know, younger females get headaches a lot. So those are kind of some of the factors overall that you're looking for, you know, when you need to ask questions that are real prevalent to, you know, having a more definitive diagnosis. Now, when you look at tension type headaches, this is one that's most common, and it's located around the head, and people feel pressure and tightness, and it happens typically later in the day, okay? So, you know, genetic predispositions to that is, you know, hyperexcitability of the peripheral afferent nerves. So these are nerves kind of going away or coming back to, you know, the brain, and it's causing nociception pain. So basically, it's usually a muscular origin, and that's why they call it tension, okay? So if you're sitting at your desk and you're leaning over all day and bending the neck, you know, in flexion, that'll cause a lot of muscle tension. And overall, that can cause those tension headaches. And a lot of times when you release that tension, obviously, that's a big player in trying to get rid of tension headaches, because that's the whole point of it. It's tension, okay? So tension headaches, you know, are pretty prevalent, you know, between the age 40 and 49 overall. You know, females tend to be a more 4 to 5 ratio, just for whatever reason. I'm not, you know, I don't think there's a lot of hormone issues here as far as tension headaches, but it could be, you know, the flexion, the head, maybe sitting at the desk too much. It just kind of depends. So, but tension headaches are very prevalent in most anyone that has tension and has stress and does, you know, sits at a computer and does those things all day. Now, as I said before, this is the one that's the most common that I see as far as a chiropractic sort of medical biomechanic problem, all right? So behind the neck here, you can clearly see there's trigger points, all right? So when you have trigger points, muscles get real tense back there, all right? So when your muscles get tense, there's a nerve that goes, you know, in what's called your suboccipital area, and it has referral patterns up to the front of the eyes. So people will say, I get a headache, lower neck, all the way to the front of the eyes, and that is a classic cervicogenic headache. Classic. Very commonly mistaken for, you know, like a migraine. And here's kind of how it looks. You can see all these nerves down in here, all right, that's in the neck. If you're flexed all day and you're leaning forward and you're, you know, yeah, getting tension, but you're getting compressed in this C1 nerve. That's the main one. If you're getting compressed in the C1 nerve because of your postural positions, that'll easily put pressure on that nerve and give referral patterns up to the eyes and up the head, top of the head, those type things. So cervicogenic headaches can be very commonly mistaken for migraines, when in, you know, treatments for it can really, you know, give us a lot of relief instantly with certain things that we can do, and we'll explain that. Once again, it is most common in females, and you know, people in their 40s typically get it. And my guess is because people in their 40s have worked a long time. That's my guess. But here are some of the characteristics of a cervicogenic headache. It's usually either on one side, it could be both sides, located pretty much everywhere. Front of the eyes, which is the orbital, temporal, occiput, which is in the back, could be moderate to severe, could last hours to days. It just depends on the posture. If you can get out of that postural tension and get pressure off that nerve, then the headache usually goes away, and it usually goes away pretty quick. So there's a lot of things you can do for it, but with this comes neck stiffness and range of motion limitations overall. So it's easily confused with other types of headaches, but with a good exam and good, you know, review of the presentation overall, there's a lot of things you can do instantly to get rid of these headaches, and we'll discuss that here in a little bit.
So the first step in any headache, and we can talk about cervicogenic headaches since that's one of the main headaches, but you're talking tension, even migraines, chiropractic therapy overall, just chiropractic alone has helped headaches for decades, okay? And so that's why one of the most common complaints that I see just coming to a chiropractor is headaches. That's the number one thing a lot of people come in for. And sometimes it's migraine, sometimes it's cervicogenic, sometimes it's tension. But we figure the things out in our exam and in our assessment, you know, like we said earlier in the video, to kind of determine which one is it. So talking cervicogenic, as I said before with the diagram, right on the bottom of the skull, you got that C1 nerve that's going in there. And a lot of times you'll get compressed. And the reason for that is, we think these neck movements, you know, extension and flexion play a big role, and it does, but it's these small little muscles, real tiny muscles. It's kind of what they call a triangle. It's the suboccipital triangle. It's these triangular muscles that come off the skull and go to the C1 and the C2. That's what gets compressed. So if you're sitting on a computer all day and your head kind of like is looking at the computer, what will happen over time is if that neck's straight like this, you'll end up doing this. And you'll look at the screen, and what's happening here is you're going forward and you're compressing where that nerve comes out. And that gives you referral patterns up into the eyes and up into the head. And that's a real cervicogenic headache. But you can get nausea with it, dizziness, those type things that would confuse it as a migraine. So chiropractic manipulation of the neck overall is one of the most common things that can get rid of a cervicogenic headache, sometimes literally instantly. Sometimes you'll do it and the patient will get up and go, man, I feel great, it's gone. And that's because you've released that nerve, you've released that tension literally at that suboccipital area. Now some of the other headaches like tension headaches, even migraine headaches and cervicogenic headaches, you can get relief just by manipulating C1. So think of your C1, the first cervical vertebrae. It kind of looks like this. Now obviously this is a big, you know, diagram, so to speak, but it looks like this, and these little nerves, the nerve wraps around these little, you know, pillars, what we call them. So if this guy is off any way, you know, if we sleep on a pillow like this all night, this guy could get compressed. And what happens is that C1 vertebrae will shift a little to the left or the right. And we have a way of assessing to say, oh, it is the right or the left. But one of the best techniques to get rid of headaches is what's called a toggle recoil, okay? And that's when you use a table like this, and this is like the headpiece where they're laying down. What you can do is get this table to lift up. So instead of lifting up like this, it just goes straight up. And the person's laying on their side, kind of like this. And what we do, there's a recoil where you're kind of using what's called the pisiform right on that C1 vertebrae. And you do what's called a reinforcement, and it's a quick thrust, just boom. And you let the table drop. So then you lift that thing back up. And once again, bang. And it's real quick and subtle. You hardly feel anything. And just moving that little C1, boom, right back into place, literally you take pressure off the nerves. So just from a chiropractic, not even talking physical therapy or medical, just from a chiropractic standpoint, you can really help headaches with consistent treatment and sometimes with instant gratification. Now we know to fix problems overall so you don't keep getting them over time, you got to become functionally resilient with physical therapy. And we're going to explain that now. So when we think about physical therapy, we've said this for multiple videos here. Becoming functionally resilient is the key to most all problems. And what I mean by that is when you're functionally resilient, that means you can do the things outside of your work and outside of the rehab setting to
pick up your kids, look at a computer, pick boxes up. Do things where the muscles do what they're supposed to do so the joint doesn't take the hit. Get functionally resilient. One of the biggest things with headaches, whether it's a tension headache, cervicogenic headache, or even migraines, sometimes migraines, is posture. We talked about it before. And like, big one is an upper cross syndrome, where your shoulders round, the head gets forward, and as we already said, you're going to get compressed in that suboccipital area. So just fixing this and getting you back to a normal posture limits that stress that you constantly have every single day. All right, so our physical therapists are excellent at recognizing that it's upper cross syndrome, but even more so, do an array of tests on you and ranges of motion and muscle strength and tests to say, hey, this is the muscle that's over dominant, which is typically your upper trapezius muscles, what's called the scalenes, the sternocleidomastoid, things that are pulling you up, the lats, latissimus dorsi, all these guys bring you forward. And there's weak muscles that they determine, hey, these are the muscles that need to be worked. These are the muscles that need to be stretched, and this is how we need to integrate into different movements while you're moving the hands and the thoracic, okay? The thoracic is another area, that mid-back, where these muscles get very kind of tonic and they stay here. So it limits your ability to move and rotate. So every time you're doing stuff, that neck takes the hit the most. Therefore, now I'm stiff. Now my joints don't move. Now my muscles are tight. Now I have a headache. Suboccipitals are compressing that nerve. So it's a process and a pattern that happens to people daily, over and over and over and over again. And the key is, using chiropractic to get the joints moving and take pressure off the subocciput area, but literally make yourself functionally resilient by fixing the muscle problem. That's where physical therapy comes in, and that's one of the only ways to get to a point where you're not getting those consistent headaches.
So with medical integration, people say, what can a medical team do? So what we try to do here at South Georgia Spine and Joint is we're regenerative medicine. So we're trying to limit, one, surgeries, okay, and two, literally medications. Now I know sometimes people need pain medication, sometimes people need certain things to kind of get them through what they're going through, but our goal for you is to try to limit and eliminate, in most cases, any dependency on any type of drug. So our medical team is great at doing trigger releases on certain parts of the body. So there's tons of trigger points that happen up on the top of the scapula. People get this area that sit on, computers all day and pick up kids and whatnot. Scalene, sternocleidomastoid, suboccipital areas. Sometimes, with a consistent dysfunctional pattern for years, these muscles can actually get so tonic and so tight that you start to have these little trigger points, and they get flared up by certain movements and patterns. So sometimes I'll see people come in where it's like, I want to move the joint. I want you to become functionally resilient, but you're so tight, the medical team can go in there and limit some of that tightness and get those trigger points to sort of release, so to speak, and then you can get better range of motion. You can get better exercises with the muscle because you're not getting that restriction. There's a ton of things at South Georgia Spine and Joint that our medical team is certified to do. A lot of cutting edge techniques that people don't realize. So depending on the situation of the headaches, the medical team is great at doing their own assessment and their own evaluation to say, hey, with working with the physical therapist and the doctor of chiropractic, we work together. Here's the best thing we can do to be an integral part of getting rid of your headache. So we've discussed all the different types of headaches, okay? And like I said, some of the most common ones, cervicogenics, very common, tension headaches, migraines, those type things. The biggest thing is understanding how to medically integrate getting rid of problems. And I see this over and over again with any problem, is we don't use that approach a lot of times. We think going to, say, a chiropractor is a one and done type thing, crack me and we're ready to go. Well, that's not even really how it works. There's a very intricate part of, you know, assessing and diagnosing and understanding, you know, the human body and the biomechanics and, you know, what are the past medical conditions and what's really causing that headache. What's, you know, putting those things together with highly educated professionals is the first step. So there's a lot more to it than just getting an adjustment. It's about understanding why you're getting the adjustment, where you're getting the adjustment, what technique are you going to use with chiropractic. You know, how is the physical therapy team going to approach your posture, and how is it going to approach the tight muscles and the weak muscles, and what do you do during the day? You know, that's going to play a role if you sit a lot and how they treat you. You know, how is our medical team, what techniques are they going to do to release some of that tension and get some of those trigger points to release? That's how we got to put it together as a team. And that's what we do at South Georgia Spine and Joint. It's very specific to you based on the exam and the assessment, the x-rays, possibly an MRI, you know, or a CT scan, whatever we need to get. But we put all the pieces together to understand, here's exactly why you're having headaches. And here's the type of headache. And here's the solution for that headache. And when we're talking trying to solve problems, I mean literally solving the problem. I get so many people that go, yeah, I have this over and over and over again for years. Well, your problem's not solved. And there's a reason for it. You've never used medical integration. So at South Georgia Spine and Joint, if you're having headaches and it's debilitating your life and you're dizzy and you're even getting vertigo, and that's for another discussion because there's a lot you can do for that as well. But when you're putting all this together and you're having, you know, a struggling time trying to get somewhere where you're not getting these headaches to reoccur, schedule an appointment at South Georgia Spine and Joint. We'll assess you in depth. We'll do all the necessary due diligence to understand your condition and understand how to approach it. And you're going to use a whole slew of a team, from medical to physical therapy to chiropractic and maybe even possibly massage, to solve your problem once and for all. So for South Georgia Spine and Joint, this is Dr.